Was FDR right when he spoke to the danger of fear itself? Experts explain that when we're threatened by real danger, an area of our brains called the amygdala goes into action to help us survive. The amygdala stimulates the adrenal gland to release adrenaline, which in turn prepares us to defend ourselves or to run, the so-called fight or flight system. Adrenaline causes heart racing, sweating, blood flow to muscles, preparing us from an attacking enemy. Fear was designed to help us survive. But fear does not always help us avoid danger. During my medical school rotation on the psych ward, I observed people with paranoid schizophrenia, an emotional brain illness manifested by an inappropriate and overwhelming fear that others were plotting against them. These patients had lost touch with reality and had bizarre thoughts, all resulting from a neurochemical imbalance that is really still not perfectly understood. But what stuck in my med student brain was how their deep-seated and overwhelming fear was somehow connected to such severe mental illness. Fear appeared to destroy them. Well, most of us have minor inappropriate fears resulting from small, past minor emotional traumas such as going near water, seeing the doctor, flying in airplanes, walking near swooping birds, speaking in public, and the list goes on. Trouble comes when a fear keeps us from functioning normally, thus making it a phobia. Something similar to life-interfering phobias is post-traumatic stress disorder, or PTSD. This results as a consequence of specific, severe emotional trauma and an overwhelming panic-like adrenaline surge when the person is reminded of that bad experience. Presently, we live in a not-so-dangerous world, quite different than from our great ancestors. Now, although there are times when we need that adrenaline surge, we're generally more in danger of harm from fear itself, like in those with paranoid schizophrenia, or phobias, or PTSD. Most of the time, we can better sidestep what can hurt us in a rational and cool way by identifying, avoiding, and/or dealing with danger without paralyzing panic. Antipsychotic medicine is unquestionably the best and mainstay treatment for schizophrenia, and PTSD needs its special meds and counseling. But for simple phobias, I prefer antidepressant over anti-anxiety, Valium-like medicines. And when appropriate, advise psychologists armed with programs to help us gradually face and practice and overcome inappropriate fears. Just the right amount of fear can save us from an enemy, but fear itself can be very bad.